minutes, I just wanted to share some of the peer-led research that was developed and collected during COVID. The author of the survey and the research was Annie Madden. This survey was done by Input, but I know many other networks around the world, as soon as the pandemic kind of started, also did their own research in regions as well. So that was one part of the response to COVID that peers led on, in being able to collect information on what was going on in the ground and impact of COVID on people who use drugs. So next slide. So just sharing some of the demographics of the survey. So there were 290 respondents across 54 countries. The survey was translated into multiple languages, including Spanish, Italian, Hindi, Portuguese. In terms of gender identity, almost 41% of respondents were female, 42% male, 1% identified as trans, 1.5% non-binary, 0.5% gender fluid, and 1% as other. I would say, with the survey, even though, quite a number were women or gender diverse, that, the information, we did not have the resources to disaggregate necessarily the data by gender. So, that's definitely, I think, a gap that, would be, I think, good to address going forwards as well. So we also collected race and ethnicity. So the numbers are here: 43% white Caucasian, 3% Black African American, 7% Russian, 4% Asian, 5% South Asian. So next slide. So just some of the challenges. There was definitely a lack of open and systematic data collection in relation to COVID-19 and people who use drugs. We asked a range of questions. I think they ended up being 60 questions. We really appreciate everyone's time on it. But they, crossed a broad range of areas, including health and harm reduction, drug use and safe supply, drug laws and detention, and human rights. I know we're going more into, human rights in the following session, but there was definitely, majority report increase in policing for drug possession and small scale supply. Approximately 1/3 reported that people who use drugs were being harassed or forced into compulsory detention centres, rapid detox, quarantine camps, and homeless shelters. So next slide. We were concerned from the beginning and did hear that emergency powers were being used to target specific communities. Of course, the respondents were vast majority people who use drugs, and identified more than half said people who use drugs were being targeted. Women who use drugs, about 1/3 reported that. And of course, homeless people and people of colour and First Nations people. Many people were fined for breaching lockdown regulations, and almost half reported people who use drugs being fined. So some of the testimonials saying, with no money to pay the fine, people were sent to prison, and people who have nowhere else to go, especially people in open areas of drug consumption who were easily targeted, were also fined. And I think Svetlana, in her presentation yesterday as well, in the survey covering women from key populations, also reported this. So next slide. So we did have some questions specifically focused on women who use drugs and violence, and 1/3 said there was an increase in violence towards women who use drugs, including intimate partner violence. One respondent described the situation as having nowhere to run, couples fighting even more in lockdown, and female sex workers experienced threats of violence during COVID, including demands of quick sex and being forced to beg for money by partners due to less work or face beatings. So next slide. The next two slides were based on some questions where we wanted to, find out in what ways peers were supporting each other through the pandemic, on both an individual level and at a network level. So, the myriad of ways where support and solidarity amongst people who use drugs during COVID were shown or delivered, were delivering harm reduction equipment, buying food for other people, help with advocacy, looking after each other, mobilizing around a specific issue, cooking meals, financial support, and providing, shelters and safe place to stay, use of phone data and internet, which of course is how many of us were able to connect during lockdown, and help with transport and helping with children as well. So, some of the testimonials that came from people was, one respondent said they felt really proud of the ideas and attitudes of people who use drugs and the way that people take care of each other's needs. So next slide. So we also heard from Svetlana before, and of course other presenters, about the role of peer-based networks during COVID, and the different range of services that were provided. So here are just a collection of some of the testimonials, also such as peer-led outreach workers as well, being able to provide food packs, providing access to ARVs, and also I think being able to provide really quick and rapid information on how to protect each other and how individuals can protect themselves during COVID, and just really being able to provide that kind of rapid information that was needed during COVID as well. And just the last quote I'll just read from, so studying the formation and success of strong communities, comparing with our realities, and mobilizing around the belief that we can change our lives and society's attitudes to drug use. So next slide. So yeah, this was just the last slide, but I think some of the other ways that community supported each other during the pandemic was that there was a lot of community-led advocacy, and as we discussed, increased access to take-home doses. A lot of the community around the world led on that at national level, identifying that as a key need. There were also stories of specific shelters being set up for people who use drugs that would meet needs, and also communities negotiating with police to reduce the targeting of people who use drugs as well. Also, other ways were providing linkages to emergency grants. Input also ran a small emergency grant as well, so trying to get rid of the barriers to funding for many of the peer-led networks around the world. I know Sharon's on this call, but there was a particularly kind of stellar example from India with the Global Fund COVID grant, that the community there with key populations were able to advocate for millions of dollars from the COVID-19 response mechanism. So I think that was particularly proud moment, and just a really great example of how communities working in solidarity can access emergency funding as well. So just in closing, just wanted to obviously thank and acknowledge all the individuals and peer-led organizations who took the time to respond to the survey, and also, just for all, I think, the amazing work that peers and community did around the world in the midst of a global pandemic.